Okay, John Candelopoulos here from our center in Athens, Greece, the Laser Vision Ambulatory Surgery Center, clinical professor of ophthalmology at NYU Medical School, New York City, New York. Of course, we're far away from New York right now. We're gonna discuss together a very, very interesting case, which I think underlines many problems with refractive error, young people, and our work as clinicians. We're seeing here the cornea of this 24-year-old, very, very smart, very well-educated young lady. Actually, she was 24 when she started having some problems. She's currently 28. So she underwent a very serious infection from Acanthamoeba while showering. She probably acquired the protozoa showering in one of the biggest capitals in Europe, London. So she was wearing contact lenses. The Acanthamoeba probably seeped into the cornea from the regular tap water in London. No history of swimming in lakes, pools, or any other aspect that would affect that. And she was treated, unfortunately, with monotherapy there in a very good institution, just PHMB. We insisted at the time of the initial diagnosis that she should go on double therapy just to be sure. Unfortunately, we were right, they were wrong, and she persisted with the infection for a very long time. She ended up resolving the infection and ending up with this very significant cornea scar, her best corrected visual acuity dropping to under 20/100. And then she was recommended by her treating physicians there in the UK to undergo a cornea transplant to treat this irregularity. We said, all right, let's hold off, let's study this a little bit, and try and find a better solution. We started treating with steroids. We waited for a while, and we ended up performing a phototherapeutic treatment. To note that our cornea at the time was like this. We can see the jagged edges of the scarred stroma and how irregular the epithelium is in healing this dense scar, and we were able through our treatment to be able and make the cornea this clear. Best corrected visual acuity has improved to 20/25 plus, and our cornea now in today's date looks, I'm trying to find the picture for you. It's very characteristic. Looks much better. The scar has resolved. And we are today in this picture, we can see that the edges of the scar are much smoother. The scar is far less dense. The epithelium is still healing. We're at 20/25, but with a hyperopic correction of +6. So although our topography guided treatment did not correct any significant myopia, it appears, it normalized the cornea. It appears that the healing process made the cornea flatten with time and resulted in a significant flattening. Topographic-wise, her other eye, which had a curvature of about 44 diopters, underwent LASIK. She's 2010 now with ray tracing LASIK. So we assumed that this eye had the same keratometry, about 44 diopters, 44 and a half. It is now 38 diopters in curvature. We can see the curvature here, the cornea curvature here. Clear cornea, significantly flattened in this area, and when we look at the scar, it is a drastic difference going from here to here. We're 6 months out, the phototherapeutic topography guided treatment. We've accomplished our goal is to avoid a cornea transplant, and now the question is posed, what do we recommend as treatment in this 28-year-old lady who, of course, is very reluctant in wearing contact lenses. Her vision with a contact lens reaches 20/20. She's ametropic in the other eye, as I mentioned. She had LASIK, and she's uncorrected 2010. The other options here would be a lens-based procedure, which at this young age would not be my first choice. The second choice would probably be if she became contact lens intolerant and hyperopic ICL. She has a deep chamber being myope. And we could definitely employ that option, although we know that in hyperopia, the ICL does not come with the centriflow model, and we do have to combine it with a peripheral iridectomy. So this is the case of the day. A very cornea-wise, extremely good outcome. Refractive-wise, a refractive surprise, but we're seeing here on how nature plays a significant role and how we cannot predict how the healing of a very significant cornea scar will change the elasticity index of this cornea and create a hyperopic shift on this otherwise a beautifully clearing cornea with now a significant hyperopic correction. Hope you found this presentation and the ever-going daily challenges that we're faced as clinicians, and hope we all learn some from this case and take it on to our clinical practice from here on. Thanks so much. This is John Canalopoulos signing out.